Especially of that report. And remember, I'll be engaging the KEPSA CEO, Carol Karuga, on some of their proposals shortly on the program. So stay tuned for that. But let me take you through one more report here. Now, while Nairobi remains the epicenter of the coronavirus in Kenya, the war against COVID-19 notwithstanding is equally being fought in the counties. Citizen TV has gained exclusive access into the Embu Level 5 hospital, ICU and isolation facility as part of taking stock of the county's preparedness to handle COVID-19. The presence of unoccupied ICU beds, health experts are warning, should not be a license for any county to relax.
No other disease in recent times has become as costly to treat as COVID-19. For the healthcare workers here at the Embu Level 5 hospital, nothing can be left to chance when donning the personal protective equipment. Beginning with a long-sleeved fluid-repellent disposable gown, an additional apron, additional gloves, a respirator, goggles for eye protection, and shoe covers are part of the armor. And a constant reminder that healthcare workers are dealing with a highly infectious disease.
We have 20 fully functional ICU beds. We do have the general ICU where we have patients with other medical conditions, surgical conditions, which at the moment is fully occupied. The COVID ICU and HDU, they are not fully occupied at the moment.
It's a central location. We get so many, of course, patients from the neighbouring counties. We are talking about Tharaka Nithi, Kirinyaga, Machakos, these are the Rua side, Makueni.
Inside the male isolation ward Wednesday, there are only 2 patients. The county has reported to have 358 isolation beds, with more unoccupied. The one healthcare worker who attends to the patient who is stable checks his vital signs. Another patient is at the intensive care unit and is on supplemental oxygen, and he requires constant care, close supervision, and life support equipment. Each patient could have 1 or 2 dedicated nurses and is under constant monitoring.
We assess patients in the outpatient when they come. You see, there are patients who are stable enough. If we suspect they have COVID, we do take them to the isolation unit and find those are patients who may not require oxygen. On the other hand, there are patients, when you check their saturation, how they are breathing, you see that they may require oxygen. And we take them now to the HDU, high dependency unit, where they get supplemental oxygen. And then there are other patients who are very sick. And what happens to those ones, again, depending on the level of severity, those ones, we may take them to the ICU. So it depends on the severity of the illness, and that's what guides us. That's what guides us into where the patients are going to be treated.
Here at the ICU, there are also ventilators. A ventilator, as a tube, is introduced into the lungs through the patient's mouth and throat. The other end of the tube is attached to a machine that pushes air in and out of the lungs. The ventilator mimics respiration and aids in both breathing in and breathing out. In most cases, the machine completely takes over breathing so that the patient can rest and allow their body to heal.
Our hospital, that is Embu Level 5, is well supplied with oxygen. We have actually too much of it. We have both owned and new oxygen plants that are fully operational. We have not had a single patient actually not getting attended to as far as oxygen requirement is concerned, because we have all the capacity, we are having it well produced.
There is no county in Kenya that has not been affected by the COVID-19 pandemic. The only lines of distinction are the different capacities each county has in terms of testing, isolation and intensive care. However, for even the counties with fewer admissions, this could just be a calm before the storm. For as long as counties are interconnected and there is movement from one county to another, the chains of transmission are not yet broken, and one county's burden of infection, death and hospitalization could easily shift to or be shared with another neighbouring county. Dorcas Wangira, Citizen TV, Nairobi.
All right, as mentioned earlier, the Kenya Private Sector Alliance, KEPSA, has issued